Colic, What You Need to Know. Narrated and presented by Rachel Dorton. Throughout this presentation, I will be covering a wide variety of information that is important to know about the topic of colic. This will include what colic actually is, symptoms of colic and how to recognize it, what causes colic, theoretical causes of colic, including smoking, sensitivity, imbalance of bacteria, diet, and postpartum difficulties. I will also be discussing breastfeeding versus bottle feeding and colic, cures and home remedies, seeking help, advice from other mommies, and I will also provide a list of references at the end of this presentation. Let's begin by discussing what colic actually is. Colic is uncontrollable and inconsolable crying. It is seen in babies as young as 2 weeks old and as old as 4 months. Usually, by the 5th month, symptoms of colic have almost, if not completely, subsided. In fact, most of the time, colic is almost never seen in babies older than 4 months. Of course, like any situation, this will vary from baby to baby. Colic is often referred to as the 3 R's, after a man by the name of Dr. Morris Wessel conducted extensive research over the topic. He described colic as inconsolable crying for at least 3 hours a day, for more than 3 days a week, for over 3 months. He also concluded that the crying begins consistently around the same time and is often said to start many times in the evening rather than in the morning. This will start to make a little more sense as we go over common causes of colic. The data collected by Dr. Wessel is found to be consistent among colicky babies and therefore is widely accepted by other doctors as well. Most doctors agree that colic is usually abdominal pain as well. What causes colic? Contrary to popular belief, gas is not the main cause of colic, but instead just adds to other symptoms and theoretical causes. What actually happens is that because the colicky babies are crying so hard and screaming so loud, they are actually taking in a lot more air at one time than they are used to. This causes air bubbles in the tummy and extreme discomfort for the babies. Many times, passing gas or having a bowel movement will help to soothe the baby. So instead of gas being the cause of colic, colic can sometimes be the cause of gas. Now, with that being said, at this time, there are no known or proven causes of colic. However, researchers have developed some theories as to what could be the cause of colic. These include smoking, both in utero as well as postnatal, sensitivity, an imbalance of bacteria, diet, postpartum difficulties, and there are others, but these are the most popular among discussion today. The first theoretical cause I'm going to discuss is smoking. An increase in colic has been seen in babies subjected to tobacco smoke both after birth as well as in utero. Both cases have led to a significant increase in a hormone called motilin. This is located in the gut. Motilin is used in digestion and the breakdown of food into nutrients. It causes contractions of the muscles in the stomach as well as the intestines in order to move food through the gut. Because the amount of motilin is increased, the speed at which the food is moving is also increased. This causes extreme discomfort in the baby's belly because the system is working harder in order to keep up with the speed at which the food is being moved through the system. It can become very painful for the baby, and because they have no other way to communicate the discomfort, they will choose to express themselves through crying. Think about it this way. If your body is working a little bit harder, say that you're working out extensively, you're going to feel some discomfort if that's not something that you're used to or something that your body is used to doing, and you're going to communicate some sort of pain or some sort of discomfort. Say you're breathing a little bit heavier, or you're expressing that you have a cramp in your side, or that you're extremely thirsty because you're not used to exerting this much physical energy. The same thing happens with a baby whose system is working a little bit harder and a little bit faster, but they cannot use words to communicate this discomfort. The next theoretical cause that I want to discuss is sensitivity. Some babies are a little more sensitive to others and use crying as a type of physical release. After a long day, babies, just like adults, can become distraught. They can become physically sensitive, especially to lights, sounds, and other sensations, and because they are not able to tune that out or focus on one at a time, they might require a little bit more attention. So think about it this way. Their sensory input isn't as well developed as an adult. They're not able to tune out just one sound or just the lights. They're having everything come at one time. So because of that, sometimes it can become too much and they become overly sensitive. A lot of times parents will choose to put baby in a room where it's dark and quiet, or choose to focus on one sound such as shushing or white noise is also commonly recommended. Or they just choose to provide baby with a little bit extra attention, so maybe holding baby close to their chest or providing some kind of physical connection so they know that they are safe and that they can focus on just one thing at a time. The next theoretical cause that I want to discuss is an imbalance of bacteria. Bacteria is needed in order to break down and digest food. When that bacteria is out of whack, babies can have trouble breaking down their food into the nutrients they need, causing extreme discomfort. Researchers are unsure if it is the lack of bacteria or the presence of bacteria that causes the problem. We need to keep in mind that when babies are born, they're born with a clean slate, meaning they're born without the necessary bacteria that people have to be exposed to in order to develop a digestive system as well as an immune system. So doctors are unsure if it's because they lack this bacteria or because they are recently exposed to it that it's causing the colic. However, they do know that the balance of bacteria is out of whack and that it has been proven in some cases that providing a probiotic has helped. So because the bacteria is somehow out of whack in certain babies, they'll provide a probiotic which will help to balance and regulate everything within the system in order to help digestion and the breakdown of nutrients flow a little bit more smoothly. It'll also help to reduce gas and to help reduce the hardness of the stomach, which is where so much of the pain is coming from, causing the baby to cry and to scream so loudly without cause. So regulating that bacteria is really what's going to help them in the long run. Now, this doesn't happen for all babies. It doesn't help all babies because this isn't the set cause for all of colic. Some babies have other issues, and it may have nothing to do with balance, but we do know that it has been proven in some cases that a probiotic can help. The fourth theoretical cause is diet. Like adults, babies can also develop an allergy to milk protein, or they can become lactose intolerant. Of course, this is usually seen in formula-fed babies, as formula is usually cow's milk based. Colic in babies who are breastfed could be directly related to the mother's diet. So not necessarily that they're lactose intolerant, but they found an allergy to some other kind of food that the mother is eating. At this time, there isn't a list of foods that mothers should avoid while breastfeeding, nor is there a list that they should be eating more of while they're breastfeeding either. The reason for this is because with babies, it is so different from case to case. One baby could find an allergy to one thing that his or her mother is eating consistently, and another baby could have no problem with that, but have another allergy to something else that the mother is eating. Right now, doctors just recommend to continue a consistent diet of stuff that mothers would normally eat regardless of if they are breastfeeding, and just to keep that consistent so that they can find out later if there is an allergy, what the baby might be allergic to, so that they can eliminate that in order to help breastfeeding a little bit more smoothly, as well as to eliminate any more issues that would maybe cause colic or some kind of pain within the baby's abdomen. So the next theoretical cause is postpartum difficulties. Postpartum depression is common in many new moms. Research shows that up to 20% of new moms or recurring moms have shown signs of postpartum difficulties. It also shows that babies can sense when mommies are stressed, depressed, or anxious, and that they will respond accordingly. Research also shows that mothers who were anxious during pregnancy will show signs of anxiety after pregnancy and vice versa. So if we see that the mother is anxious after pregnancy, there's a good likelihood that she was also anxious during pregnancy. When babies experience anxiety in utero, placental blood supply is constricted. This causes an increase in startle response as well as cortisol, making the baby easily agitated. So, just like the mother, if she's experiencing some postpartum depression or some other postpartum symptoms, she might experience some easy agitation as well, and the baby is almost mimicking that. So they're going to kind of go off of how the mother is responding to them as well as the situation and the environment around them. So if the mother is acting a little bit more calm, collected, and confident, the baby is going to respond to that as well. However, if the mom is acting a little bit more depressed or anxious or even frustrated or angry, the baby's going to feel that as well and not be able to calm down as easily as maybe another baby could if the parent was a little bit more calm or had some more patience in that sense. It's kind of like when babies get a little bit older and they start to develop that separation anxiety as well as stranger danger. They can sense who they want to be around and who they're not comfortable with. This develops as early on with the senses, and that's in that way that they can develop a attitude towards what's good for them and what's not so good for them or what they're comfortable around. Are breastfed babies more or less likely to be colicky? So I know there is a huge conflict and a huge discussion always about breastfeeding and bottle feeding and which is better for the baby. When it comes to colic, there isn't a direct link between either one. Colic is found among all babies, and that's despite gender, race, whether they were born to smokers or non-smokers, and whether they were breastfed or bottle fed. There is a link to bottle-fed babies because of the milk protein, the cow's milk protein, and the lactose intolerant. In that sense, it might be a little bit higher, but that's again just because you see a lot more lactose intolerance than you do any food allergies to breast milk. That's not saying that if you bottle feed, you're going to have a baby who's more likely to be colicky, but you might have a baby who has an allergy that you might find out a little bit sooner than if you were breastfeeding. That's really the only time that this would ever come into play, is just through diet and whether or not an allergy is discovered or developed by the baby. So again, there's not really a direct link between either bottle feeding and colic or breastfeeding colic and whether one is better than the other, because it's found within all babies. And all babies can develop an allergy to pretty much anything. And that's, again, within the formula that they're being fed, if that's a milk protein base, or if they develop a lactose intolerance, or if it's from the mother's diet herself. So it could be either way developing an allergy that's going to cause some discomfort within the baby's body. Unfortunately, at this time, because there is no direct cause of colic, there is no set cure either. However, probiotics have proven to be successful in many cases. That doesn't go for all colic cases, but for many of them, as stated before with the imbalance of bacteria, probiotics can definitely help to regulate a lot of stuff in the symptoms and help to calm baby down a little bit by easing some of that abdominal pain. Talking to a doctor might be the best bet in finding out what's best for your baby, but other mommies have found some home remedies that have helped them, and those include laying the baby across your lap and rubbing his or her back, providing infant massage, pacifiers, warm baths, changing formulas. Like I said, if a baby does develop an allergy to that formula, sometimes it's just a simple change of switching from a milk base to a soy base or something like that. Getting some fresh air or just a change of scenery, creating movement, so sitting in a rocking chair, providing a kangaroo bounce, or even going for a ride in the car has proven to be effective in some cases. Creating closeness, so holding baby very close to your chest, providing them with some sort of comfort like a heartbeat, or maybe try swaddling them with a blanket so they feel a little bit more secure. And of course, again, talking to a doctor so that you can find out what's going to be best for their specific situation, or if something else needs to be done in order to just make them a little bit more comfortable. So again, talking to a doctor is going to be most beneficial because they're going to be the ones who can determine if something else might be wrong. Colic, if it follows the 3 R's, that's usually exactly what it's going to be. It's going to be just physically colic, and it's specific to your baby. But sometimes it might be something else, or something that a doctor can fix within their clinic or prescribe you to help your baby out. And ultimately, that's what we want to do, is we want to get baby feeling better so that you can feel a little bit better about bringing them home and being alone with them when this starts to happen. If you do find that you can't handle the situation anymore because colic has gotten to be too much to handle, or because you just don't know what to do anymore, call someone. Call anyone who can come and just relieve you for a little bit, let you take a break, and just take a step back from the situation. There are also some hotlines that offer some advice or help in these types of situations. The 24-hour parenting hotline and the crying baby hotline are specific to colic, and they basically, like I said, will just give you some advice over the situation, or just listen to you if you need to talk about it, or help you to know what's going to be best to do at that time. I have provided some advice from just a few other mommies and some doctors, just because I think it's important for moms to know that they're not alone in this, that other people have experienced it, and that there is help out there. Dr. Cheryl Wu, she's a pediatrician. She advises to use the 4 S's: which are shushing, swinging, swaddling, and sucking. She says shushing would be any loud but not too loud white noises that remind baby of being in utero, which can help to calm them down. She says that swinging will help babies to respond to motion, and it just helps them to calm down a little bit that way. She suggested swaddling, which is making a baby nice and cozy and will help to create a type intrauterine type environment. And then the last thing, sucking, would be maybe a pacifier or gnawing on her own hand or even breastfeeding to give her something to focus on other than the crying. Jen Singer of parenting.com suggested cut yourself a little bit of slack. She says, you're trying and you care, and that's what makes you a good mom. If you can find something that eases the tears, then great, but don't wrap your self-esteem up in it. Babies just can't be controlled that way. So it's important to remember that it's not your fault. You're doing what you can, and like she said, you care. And so that's really what's important to remember here. Sarah Dumond, a medical doctor who is also a pediatrician, suggests to remember to take care of yourself. Babies are going to be difficult, but baby care comes from mommy care. So as long as you're taking care of yourself, you show that you actually care about being a good mom as well as taking care of them. Allison M., another local mommy of a popular blog, says to know when to walk away, which is extremely important. Sometimes you just have to walk away, and it's not your fault that you can't get your baby to settle. It's more important to set baby down in a dark room or to just set them down where you have a chance to walk away and take some time for yourself. Getting away from the crying a lot of times will help you to regather and to come back into the situation with a better attitude and maybe be a little bit less frustrated. It's so important to remember that it's okay to walk away. Again, the best thing that you can do in this situation, if there's nothing else you can do, is to call someone and visit a healthcare professional so that they can give you the best advice on what's going to work for your baby.